Good morning, YouTube. Good morning, Instagram. Welcome to the PT on Ice Daily Show. My name is Ellison Melrose, and I am here with you on Pregnancy and Postpartum Mondays to talk to you guys about pudendal neuralgia. Before we get started, I wanted to let you guys know that we have a couple courses that are about to start. So tomorrow is our 8-week online course where we go over everything from fertility, conception, all the way through pregnancy modification with exercise, into labor and delivery, and into the fourth trimester and postpartum modifications for exercise. If you guys wanted to hop into that 8-week online course, we still have a couple spots left. So go on, head on over to our website, ptonice.com, and check that out. We are super excited to get started with that next cohort. We also have our next live course coming to Utah at the end of the month. So if you guys are interested in hopping into a live course, check that out there as well. All right, so we are going to talk about pudendal neuralgia. So let's first kind of talk about what it is and clinically when we see it. So pudendal neuralgia is, the pudendal nerve is sacral nerve roots S2, 3, 4. And they come out of the sacral nerve roots anterior to the piriformis. And then that nerve dives deep back into the pelvis, and it runs along the ischial-pubic ramus. And it provides innervation to the pelvic floor and the genitals. So it can be a very important nerve. What happens when we get pudendal neuralgia? There's typically some sort of trauma to that nerve, either via compression or stretch injury or some other sort of irritation to that nerve. We see it commonly in both male and females. With females, commonly the mechanism of injury is going to be during childbirth. It'll be a stretch injury to that nerve. And then in males, we often see this. They commonly call it cyclist syndrome. So we see it in males that spend a lot of time sitting in a saddle, which is going to compress that nerve along that ischial-pubic rami. I often see it in lean endurance athletes commonly. And there's typically 3 reasons for that. We have our ischioanal fossa that is lies just superficial to that pudendal nerve, houses a lot of adipose tissue that provides cushioning to that nerve. In lean athletes, we commonly see that adiposity is pretty minimal, and so that adipose tissue that provides cushion could also be not as prevalent, and therefore there's not as much buffer for that nerve. Commonly in our lean endurance athletes, we also see a hypertonic pelvic floor. So the muscles of the pelvic floor are not as mobile, and therefore could also be causing some sort of compression to the pudendal nerve. These athletes also spend upwards of 10 to 15 hours on their saddle, which is just going to be a compression to that nerve over time. Symptoms of pudendal neuralgia, what we'll commonly see is pelvic pain. It can be a sharp or burning pain in the genital region. We also can see it as like an allodynia, so hypersensitivity to even a light touch. Numbness, tingling, sexual dysfunction, and then we also can see it as urinary or fecal issues, including increased frequency, so needing to use the bathroom more often, hesitancy, so difficulty initiating the stream of urine, or incontinence, both fecal or urinary. It's often going to be worsened with prolonged sitting. So, with this, especially in our male population, we have a handful of differential diagnoses that could mimic symptoms of pudendal neuralgia. And so when we get this patient in the clinic, we kind of want to have these other um, diagnoses in the back of our mind to rule out that versus pudendal neuralgia. So those other two are going to be Main syndrome. So TL junction can often cause similar pain in the testicular region for males. Or an inguinal hernia also can cause similar pain in men, particularly. With those, we want to look at the aggravating factors to see when their symptoms present. So, for pudendal neuralgia, we'll often see that it's aggravated with prolonged sitting. So that's something to think about. So medically, what they do for treatments of pudendal neuralgia, they typically hit it with a couple things initially, just to more rule pudendal neuralgia in or out. They'll do a nerve block sometimes straight to the pudendal nerve to see if that takes away their symptoms. They also recommend discontinuing any aggravating factors. So for our cyclists, they recommend stop cycling, which is often not an option for these athletes. And so they end up just continuing to ride and push these symptoms further. And then lastly, they also recommend physical therapy. So what I want to do is kind of talk about how physical therapy can help these athletes. And then also I want to talk clinically how we would see this in the pregnant and postpartum population. So for physical therapy, there's a handful of things that we see with this patient population that could impair neuromobility. So first of all, the positioning on the saddle. So the way bike saddles are created are to mimic um, the angle between our rami, our ishiopubic rami, and so we should sit right over that saddle. Well, the pudendal nerve lives right under those ishiopubic rami, so it doesn't really allow for much um, nerve mobility if there's already an issue to that nerve. We also see these athletes are in a constant state of flexion. So they are rounding through their thoracic spine, rounding through their lumbar spine, posterior pelvic tilting, all of which are going to increase that tension through the nervous system while being in cervical extension. So all of those positions are going to put the nervous system just at a higher tension. And then we have a potential for compression in the pelvis. So what we can do, we can improve that global neuromobility with improving neurodynamics with nerve flossing throughout the whole system. We can improve the thoracic and cervical spine mobility. Typically, these athletes are pretty rigid through their thoracic spine, so we want to get that athlete moving. We can improve the blood flow to the nervous system, the pudendal nerve in the pelvis by doing some pelvic floor relaxation and pumping of that pelvic floor musculature as well. These athletes would really benefit from a bike fit. So professional bike fitting can really improve that spinal position to reduce the neurotension and improve um, the way that their pelvis sits on the saddle. There are also specific saddles for those that may be predisposed or have highly irritable pudendal nerve that could help decrease that pressure on the nerve itself. Dry needling is also something clinically that I use a lot with my patients with pudendal neuralgia. We can provide a muscular pump with electrical stimulation to the muscles surrounding the pudendal nerve. So that's going to be obturator internus, ischiocavernosus, and then even medial piriformis to get those sacral nerve roots right as they come out of off of the sacrum there. That can help drastically improve blood flow to the nerve. We can also provide the nerve with nourishment via some other perineural needling techniques as well. Clinically, another patient population other than just our endurance athletes, when I am seeing this with our pregnant and postpartum patient population, is after the early fourth trimester phase, when our pregnant people are wanting, or postpartum people are wanting to get back to more endurance exercise without the impact of, say, running. We often recommend that they start increasing their endurance or intensity on a bike. Well, if this is a place where they didn't spend much time previously, they may not be exposed to that pressure. They could have also experienced a stretch injury during vaginal delivery that didn't really they didn't really notice during the early postpartum period because there's a lot of other things going on, including, we have a lot of swelling. Our mind is maybe taken up by the new baby. And so we're not noticing some of the symptoms that may be the earlier indicators of um, a nerve injury. And then they hop on a saddle that their pelvis hasn't really been used to for a while, even if they were riding during their pregnancy, and they start to get some symptoms. Typically, for this postpartum, mom will see this as labial pain or throbbing, just general pelvic pain. It can even refer into the buttock or down into the thigh sometimes as well. And typically, around 6 weeks postpartum is when we're cleared for intercourse as well. So we can see this pose an issue with our postpartum patients that are trying to return to intimacy with their partners, and they end up having pain with that. So that could be why they're coming into our clinic as well. So those are the common patient populations that I will see pudendal neuralgia in. A little review of what we went over today. So pudendal neuralgia is irritation of the pudendal nerve, sacral nerves S2, 3, 4. It takes a precarious kind of diving back into the pelvis, running along some bony anatomy that may increase its likelihood for compression, particularly in our endurance athletes that cycle. Symptoms are often burning, hypersensitivity, pain, sexual dysfunction, or um, bowel and bladder dysfunction, and it can be worsened with prolonged sitting. So that's going to help with our differential diagnosis. What we can do to improve this these symptoms are going to be improved global neuromobility. So let's crack some spines. Let's crack the T spine, the TL junction, cervical spine. Let's improve the nerve mobility. Let's learn how to relax the pelvic floor and improve blood flow with some pelvic floor pumping, and potentially recommend that these athletes get a professional bike fitting if they haven't done so already. So that is what I wanted to go over with you guys today. I hope you guys enjoy the rest of your July 4th holiday and are getting a ton of family time. today and enjoying the sunshine. I hopefully get to see some of you guys in our next online cohort or at one of our live courses coming up over the next couple months. Have a good Monday. Bye.